Welcome to Gazali program. Today we have with us a very special guest who I think has done a great service to Goa in the last 3 months. We have with us Dr. Edwin Gomes, who set up the Corona Care Center. I don't know exactly what that was called, but in Margao. And he stayed with hundreds of Corona patients, looking after them in the true spirit of a dedicated doctor. And when I sent him a message that I would like to do an interview with him, he sent me a lovely video of what a doctor should be. And this video, which he sent, which was a clip from a film, was about what are the qualities of a good, dedicated doctor. And I'm sure that he has all those qualities of a dedicated doctor who essentially needs to be a good human being. So Dr. Edwin, welcome. And you are here essentially to get rid of the fear in the minds of the people. Everybody is scared of Corona. So I would like you to basically first begin with what is your advice to the population of Goa?
Well, my advice to all Goans will be only one thing is, we doctors have learnt enough. We know how Corona or COVID causes the disease. We know why certain people remain without any symptoms. We know why certain people get symptoms. We know why the elderly, the senior citizens, should stay away from the public population or coming in contact with people. And we also have with us enough drugs, enough medications to use in case somebody falls sick. We already have experimented. Initially, we had only 7. Now we have around, that time when I left, we had around 160. So 167 patients who had recovered. And through this experience of 167, and knowing why that time we lost only 6, we have realized that this treatment works. So please don't be scared about COVID or Corona. But the moment you get fever, cough, and shortness of breath, not all fevers, fever, cough, and shortness of breath, please meet the health doctor. The health doctor will take your swab and tell you if you are positive or negative. Then if you think you are symptomatic, you require hospital treatment, ESI COVID hospital, which was structured thanks to our health secretary and health minister and chief minister and the chief secretary, and also built with the deputy director, Dr. Ira, plus nodal officer, Dr. Deepa, and of course with us doing briefings and debriefings. We built it up from scratch. We made it into a beautiful, lovely COVID care hospital. We are ready to serve you. So please don't get scared.
Okay, let me just since I'm also ex-doctor, I will just try to get the zest of what he just said. So friends, don't be scared of COVID. COVID is going to stay for some time. It is not immediately going anywhere. So all that you have to do is basically take the basic precautions of wearing a mask when you go in public spaces. You have to avoid going to crowded spaces, avoid big crowds, don't go there, don't have parties at home or don't attend parties. And if you get fever, then you have to basically contact the contact the doctor whose numbers, there are 5 doctors, and the numbers will be put on the screen here by Prudent Media. And then if you are asymptomatic, they are not going to pick you up and take you to the hospital by force. No. Now the policy has changed. They will keep you at home and help you recover. Now, there is so much of scare of COVID. 11 people died. Now, I would like you to analyze these deaths. How many people actually died of COVID?
Yeah, we 5 of us who have come out of the COVID ESI hospital, we have been keeping on analyzing these deaths. And we realized that most of them, at least 75% of them, had actually recovered of COVID. Recovered in the sense even the cytokine storm and the fever itself had gone. And they actually died because of their comorbidity. Like I still remember a patient who had a lung disease, We were waiting for his report, which last report came negative, but we had to get 2 reports to declare him negative. And before the second report we could send, he expired. Another person also, his first report came negative, but because he had an underlying heart condition, the second report we couldn't send the next day, and we couldn't declare him cured, and he died due to his heart failure. So like this, there are so many patients who didn't die of COVID. They had actually recovered from COVID, but they died because of the underlying comorbidity. In fact, during our stay, there were only 2 people who died of actually COVID.
Okay.
The remaining all died because of their
Some other
comorbidity.
disease. Okay.
So this message again I will want to send to everybody. Everyone has got children at home, youngsters at home. Don't let your old people go out to the market to shop. Send your youngsters to shop. There are no schools. There are no colleges going around. Youngsters are not going to die. We don't have young people dying of COVID, not only in India. Go even outside. There are no youngsters dying, unless they are alcoholics, but otherwise no. So send your young children to do the shopping. Send younger people to do the shopping. Don't send that old man. Don't send that senior citizen.
Well, thank you very much for that. And since you mentioned alcoholism, I must also point out that I think there are more people have died of alcoholism in the last 3 months than of COVID. More people have died of accidents and diabetes and tuberculosis and all this.
In fact, Dr. Subodh, I really find COVID such a humorous disease.
That's well put.
It's a very humorous disease because it has come to teach us lots of things.
Okay.
Washing our hands, we never did. Even today's doctors don't wash their hands. So we have to start washing our hands. We have to keep a safe distance. And COVID has come to teach us a very important lesson. COVID says, I'm not killing you. I'm only going to take the senior citizens. So senior citizens stay at home. COVID also says, I can be prevented by a mask and sanitizer.
Okay.
There are so many diseases that can be prevented by saying your prayers in the morning, eating a humble food, and going for exercise. That is diabetes, blood pressure, heart disease, and alcoholism. What are you all doing about these diseases? And COVID is laughing at us.
Yeah. So basically, I think people will have to stop smoking,
Absolutely.
live a healthy life,
Absolutely.
and basically wear a mask, don't go to public spaces, and wash hands as much as possible. That's all they need to do.
Absolutely.
Okay. So I would now put the next question. There are lots of misunderstandings amongst the public. Like I myself felt, like when the lockdown was sort of forced upon people, when there were very few patients. And then now there are many more cases and the unlockdown is happening. So perhaps the whole machinery, the government administrative machinery, was trying to get some time to understand what can be done, to prepare for COVID. So now, as you said, in China, there were hospitals which were put up, and patients were looked after in the big hospitals, in the stadiums. Ventilators were procured. Now, is there a need of procuring a lot of ventilators to tackle COVID?
I think that's a good question. First, let's come down to the lockdown part, and then we will move on to the other part. You see, when the lockdown came somewhere end of March. And 7th of February, Goa Medical College felt the first vibes of COVID. And we were running helter and skelter to find our PPEs. I still remember Dr. Nidhi, myself, we were looking out for PPEs. We couldn't get a PPE. We used the antiretroviral therapy, the HIV kits. And that is how we removed the throat swab, and we had to send it to Pune, etc. And it would take 3 months, 3 days for the reports to come. And we were always panicked whether we came in contact with a COVID patient or no. So by the time the first lockdown came towards the end of March, I still call that Modi first named it something, and then we called it a lockdown. Bharat or something, Jawan something, I forgot.
Okay.
It was a nice synonym he gave.
Okay.
But that was a very wise thing to do, because that made all of us read. So we read about COVID. We brought literature from Spain, from Italy, from China. We had horrible literature from Korea. We took that literature. I still remember Herschel and Nidhi going through this literature day in and day out, finding out what is crap, what is good, what is bad, what is good, along with ICMR, and we found out our protocols.
Okay.
Another thing about the lockdown was we could choose a hospital which Goa would say, okay, go ahead. You see, like everybody else, Goa would say, not Goa Medical College, anywhere else, because we are all going there. Or not Sankeli, or not Valpoi, or not Ponda, or not Hospicio, or not Chikali,
Okay.
because all the patients go there. But ESI, nobody said no, so we could go easily to ESI. But the moment we went to ESI, there was a big task. We had to set it up. Every damn thing had to be set up. Every stupid thing that comes into your mind had to be set up. For example, making a case paper, registration number, admission form, writing of history, discharge form. Suppose person wants to be intubated, or suppose someone wants something else, or the diet. Everything had to be there. So we had a big, thick book which the health secretary has got called the SOPs of ESI COVID Hospital, Goa in South Goa. So that lockdown helped us to prepare the treatment protocols and the SOPs of the hospital of ESI COVID-19. And that is why the 7 patients that we got initially, success was 100% because of the lockdown. The lockdown opened. Before the lockdown opened, the lockdown had already opened.
Yeah.
I mean, prudent media will definitely tell you that the lockdown had opened because through the guts, people had found out how to come in and get out, how to come in and get out, and they were already showing this on television. So I don't know what type of lockdown was there after lockdown 2. The lockdown 2, the CM himself is to get ashamed to look at those scenes on prudent media. And he would feel, okay, tomorrow morning, what should I say? But we missed a trick here. Probably in that lockdown 2, we should have opened up all these community care centers and started these fantastic hospitals for asymptomatics. And thereby the burden on the main ESI hospital would not be there.
Yeah.
We had increased our 100-bedded hospital from 100 to 220. And it was a big load to take.
Now let us go to the next, the ventilator.
Yeah. Coming down to ventilators, initially we had 6 ventilators, and the 6 ventilators were all for intubation. Yeah. Then we went in for more ventilators, but we couldn't get them because of the lockdown. Because they were not coming directly from Mumbai, they were coming from elsewhere. And just like what was happening in USA was happening here in India. If another state wanted it and paid a little more, they would get the ventilators much more faster.
So what is the need of the ventilator? Is there a need of the ventilator?
Yeah. We got now 200 ventilators.
We have,
Yeah. And at the moment we have they will be installed, they will be there in COVID. I think each and every bed might have a ventilator. We might reach a state where we will be surplus ventilators. So that even 100 ventilators can be taken out from here and put down in a hospital if it's created in North Goa. So I don't think ventilator shortage is going to be a problem. Our problem is only going to be the asymptomatics. The asymptomatics should not land up in the hospital. The asymptomatics should be well, W-E-L-L, well looked after in community care centers, in
and
COVID care.
And at home when possible.
At home, you can be looked after, I can be looked after. But people from slum areas cannot be trusted at home.
Okay. Now coming to the ventilator, because most people don't know exactly what a ventilator is, what is a non-invasive technique is, and what is a invasive intubation technique is. So basically, a ventilator can be used just as a mask, and that is a non-invasive technique. Yes. But then the moment they require intubation, that patient is very unlikely to survive.
Yeah. So let me put it this way. When the COVID virus enters into your body, it causes something called as a cytokine storm. And during this cytokine storm, just like pulmonary embolism from your leg, the embolus travels to your lungs.
Yeah.
The same way, microemboli are lodged in between your alveoli.
Okay.
So in between your alveoli, the interstitial space gets laden, sort of machine gun
Yeah. Yeah.
with micro
I think I will
emboli.
just explain to the general public what exactly he meant. What he meant was, in the lungs, the function is exchange of oxygen. Oxygen goes into the blood, and at the place where this transfer of oxygen happens, there's a kind of a blockage. Yeah, that's what he meant by this alveolar spaces. Yeah.
So this interstitial space, if it is clogged with this emboli, the alveolus does not expand. In fact, I still remember my colleague Edwin. He said, "Sir, this patient we have to intubate." I said, "Okay, we'll intubate," because the NIV mask was not working. And I said, "Now what, Gladwin?" He said, "Sir, no matter how much oxygen I'm trying to push, how much air I'm trying to push, it cannot go because the interstitial space is tight. It is not allowing the alveoli to expand."
Yeah, it's not allowing the exchange of. So the moment the intubation stage comes, there is hardly any
There's
chance
hardly
that the
any
patient
chance.
will survive. Yeah.
So what we normally do is we put on an NIV mask. We give lots of oxygen, and the interstitial emboli not to happen, you must be knowing very well. Anybody who travels uses a shot of heparin, enoxaparin, and aspirin, and it works wonderfully. So aspirin and 2 enoxaparins per day, and the interstitial space is spared from all the emboli. So these are the 2 drugs that we play with, along with steroid, Solimedrol, and along with that, the interstitial space is spared. And as long as the NIV tells us, so much of air that I'm pushing in is going into the lungs, it means we are winning.
Okay.
So,
Yeah.
so,
Yeah. So I will just explain to the audience what exactly you said, because, well, I'm an interpreter here. So basically, the exchange of gases, of oxygen into with our blood is basically prevented by COVID. And just with the oxygen mask, by giving additional oxygen, you can be sort of treated. The moment the need comes that you cannot, basically this oxygen mask is not sufficient, that means a lot of damage has already been done, and then putting a tube inside your lungs and keeping you alive will not work. True. So that is really a bad stage which you have reached. Now, doctor, let us go to the next. You had a very, very interesting point which you made, that instead of sending all patients to one hospital, every village in Goa has a community hall. And this community hall is used for all kind of functions, marriages and birthdays.
Now they're closed.
Now they are closed. But it will be most ideal that these are actually converted into hospitals for the local use.
Yeah, I think this idea or this concept has been given to a particular group of doctors. And this concept came after one MLA said, a person from my constituency was not taken to the COVID care hospital and expired. That is the time I woke up. At that time I was working in the ESI COVID hospital. And I contacted this group of doctors and I said, tell these people from the constituencies, why don't you have one COVID care center in a school and in a community hall? So that will cover about 1,000 people. Both places have got enough of toilets, enough of washrooms, enough of everything. And here, the COVID care angels, who are the COVID care angels? The patients who have recovered from COVID. They are not going to get COVID again.
Exactly, yeah.
They will run the show.
Yeah, with some doctors from
Absolutely.
GMC. Yeah, I think this is one of the best suggestions, that local community halls should be converted into hospitals. And the patients who have recovered from COVID, who will not going to get COVID for at least another year or more, because the immunity is already developed, they should volunteer themselves to sort of support, or they could be paid by the government to look after. Yeah, but they should basically come forward along under the care of some qualified doctors. Now, tell me, all of you who worked, how many of you actually got the infection?
Well, I was just, my wife nearly shouted at me today.
Yeah.
Because I thought I had it once and I took the whole course of HCQ and anti-flu.
Yeah.
And then I thought I had it the second time and I took a course. And my colleague Herschel was very upset with me.
Yeah.
And recently I took now and I got HCQ-induced fever.
Yeah.
So I think the health secretary, what she's doing is very, very nice. She's getting the antibody kits to Goa. The moment the antibody kits come, I will definitely know whether I got COVID or no.
So you are not sure whether
I'm not
you,
sure.
Yeah. But anyway, I mean, you have survived if you had got, now you are all fit to handle any more
My
patients.
other 4 colleagues, Harshal,
Yeah.
Nidhi, Masood, as well as Gitali, all 4 of them, I remember they were not well for about 3-4 days.
Yeah.
They must have had fever,
Yeah.
fatigue.
So they were positive.
No, we didn't check. The problem is if you check, then you've got to become negative to start working.
Okay.
And these people are workaholics. They don't like to stay without
Okay.
working.
Okay. Anyway, that's very
So-
good. Yeah. Anyway, everybody else was positive. So if they were positive, doesn't make
So they took 4 days gap and then they started working. And to our great surprise, when they came down from the COVID care hospital, they were all swabbed on the day they returned back to GMC, and all 4 were negative. You can't be negative working in a positive place for 3 months. You can't remain negative there unless you've already got the infection and antibodies. So I think we all 5 have got the antibodies.
Okay. Yeah. Dr. Edwin, I have one more question for you. I was very saddened when I sort of received the news that some villages are not allowing the cremation or burial of the people who died of COVID. So please enlighten us about that.
I think this concept of not allowing people who have died and the fear that the dead body is going to cough was there everywhere. Even though we explained to the patient's relatives that the dead body does not cough, it was difficult to explain to the relatives, to the people of the village, because we couldn't meet them. But then, what 2 great things took place in ESI COVID hospital was 2 mothers gave birth, COVID positive mothers. They gave birth to babies. And their babies were COVID negative. And what really, this came even before the Supreme Court order. What really struck us the most was we went through literature and we found out that a COVID positive mother could breastfeed the COVID negative baby. So it was left up to us to teach the mother how to breastfeed the baby. And believe me, both those mothers have gone home COVID negative and their babies went home COVID negative. Now this sent a right signal right up to people in the government that yes, COVID mother, a positive mother feeding a COVID negative baby does not transmit COVID to the baby, although the baby is so close. So how will a dead body transmit COVID to the people?
Oh, you're very right, Dr. Edwin. Yeah.
Not only that, Supreme Court then sent us a report that COVID negative people could come in and look after their COVID old people, positive. And we had about 3 people who were COVID negative coming to look after their COVID positive people in the hospital. And that started people accepting cremations and burials in their places. In fact, that first person who was negative, who came to serve his father, not only saw his father dying the right way, means with the best of treatment, but ultimately was cremated in his village. So all these things have changed the Goan perspective. I don't think Goan people today are that much scared of what they were before about their dead people not being buried or cremated in their own place.
No, thank you. I think there should not be any kind of a discrimination. One of the biggest blot on Goa's history has been some untouchable bodies were not allowed to be cremated once in a village not too far.
Yeah, the first
and this was another blot. Luckily, we are rid of this blots. Yes. So I think you have explained to us everything about COVID. So I will sum up your message. Summing up the message is, don't be scared of COVID. There are many more things to be scared of. Be scared of, not scared of, but there is diabetes, alcoholism, road accidents take a lot of lives. So compared to many other diseases like tuberculosis, malaria, COVID has been much, much kinder as a disease. And don't be scared of COVID. All that you have to do is don't go to big crowds. Maintain social distancing, wear a mask when you go out, wash your hands as often as possible, and that's all you do, and follow healthy habits, do exercise, and keep your body fit. If you are smokers, please give up smoking, because if your lungs are already spoiled by smoking, there is a big chance that you will succumb to COVID. So it is important to stop smoking. Goa was a place where tobacco entered India. The Portuguese brought tobacco from Brazil, somewhere in the 16th century, and let us now throw tobacco back from Goa. Let us be the first state that gets rid of tobacco. This is the message of COVID. And let me tell you one more thing. I'm a student of Gandhi, and Gandhi, I see a lot of Gandhi in you. Because, no, that's because when there was plague happening, which is again much more dangerous than COVID, Gandhi started working in a COVID hospital. He set up his own COVID care center in South Africa. He looked after a lot of COVID patients, joined by an English doctor and a few English nurses. And the English nurses died. Gandhi survived. But then that was his philosophy, service, which you mentioned in the little video which you sent me. So thank you very much. And let us appeal to all those who have recovered from COVID to come forward and be volunteers in tackling this disease. And let us not be scared. Thank you very much, Dr. Edwin.
Thank you.
Thanks
Thank
for
you.
coming.
Thank you.
Yeah.